Good morning, everyone. Welcome to Mental Health First Aid England's final webinar of 2021. It's fantastic to see so many of you join today's session. If you've not met me before, my name is Sarah McIntosh and I'm the Director of Delivery at Mental Health First Aid England. A little bit about Mental Health First Aid England for those of you who may not be as familiar with our organisation. We're a not-for-profit social enterprise and we brought mental health first aid training as a concept to England around about 14 years ago. We have a mission to train 1 in 10 of the population in England in mental health knowledge and skills. And the reason that we have that mission is because we believe that the more we can get mental health into everyday conversations as part of our society and our culture and our workplace culture, that we're going to remove the stigma that is often associated with talking about mental health today, and particularly mental ill health as well. So we've worked with over 500,000 different workplaces across the UK to help them with their mental health knowledge and skills training. And we've got some fantastic insights from some of those organisations as well. Today's webinar, we're joined by 3 expert panellists. I'm going to get them to introduce themselves in a moment. But the webinar itself, we're going to be focusing on our kind of reflections from 2021. It's changed our workplace cultures significantly. It's changed the way we do things. We're having to adapt all of the time. There's been lots of challenges along the way. It's been a real roller coaster of a year again. And we want to look back and reflect on what's happened, what we've learned, but also think about how we can take some of that learning into our planning for 2022 so we can plan better for our workplace cultures moving forward. So let's meet our panellists. I'm going to ask each panellist to introduce themselves just briefly and give a little bit of background about themselves. I'm going to start first with Kevin.
Thanks, Sarah, and really pleased to be on the panel today. So Kevin Lyons, he, him. I am a commentator on HR trends and topics. I'm also a diversity, equity and inclusion champion. And I'm backing many causes and supporting many projects at the moment. I'm also passionate about mental health awareness and mental well-being. I lead the global mental health first aider program at Pearson, where I work in HR, and absolutely fascinated to hear the insights that we're here today on this panel. So hi, everyone.
Brilliant. Thank you for joining us, Kevin. Ebola, I'm going to move to you next.
Thank you, Sarah. Hi, everyone. Thank you for having me. So I'm Bola Ogundeji. I'm the Deputy Director of Workforce and Organizational Development at Moorfields High Hospital. And I'm also very passionate about mental health, not because I work in the NHS alone, but I've also worked previously into large mental health trusts. So I've got lots of background working with, mental health practitioners, but it's also something that's come to the forefront of everything everyone does in the last year or two. So I'm really passionate and see the value that it can add and continues to add to what we do as healthcare professionals and the population at large. So I'm really pleased to be joining the conversation. Thank you.
Thank you, Bola. It's great to have you. And finally, Bobby.
Thanks, Sarah. Yeah, I'm Bobby Pickard. I'm the CEO of Trans in the City, which is surprisingly, it's the world's largest corporate collaboration on trans awareness. I'm also diversity, equity and inclusion manager at BP. Being trans and mental well-being are intrinsically linked. The trans and non-binary community are very adversely affected in many ways with mental well-being challenges. So it's something that I've been challenged with throughout my life, and it's something that I come into contact with daily, and I'm very passionate about understanding all of the mental well-being challenges that people have and really bringing them out of the shadows and just allowing people to be able to express those challenges that we all have at some time in our life. So thank you so much for inviting me. I'm so privileged to be here.
Thank you for joining us today, Bobby. A bit of housekeeping before we get into today's webinar. So if you're live on the call today, you'll see the chat function is not enabled today, but you can use the question and answer function to pose your questions to our panelists today, and we'll be looking at those as we go through the webinar, but we'll also make sure that we leave some time towards the end of today's webinar to answer some of those questions as well. The webinar itself, it's being recorded, and we'll make that available on the Mental Health First Aid England website later on today. And if you're attending live today, you'll also get a copy of today's slides by email after the session to save you having to make any notes, particularly of some of the resources that we will share with you towards the end of the session as well. So let's get into our main discussion then. So one of the things that we're quite interested to hear from our panelists about today is just exactly how 2021 has sort of reshaped our workplace cultures and some of the key challenges really that you've experienced in your different organisations, the work that you do with other organisations as well, and if there's anything really that's kind of actually had a positive influence on our mental health. You know, we hear lots and lots of topics of conversation where it's impacting negatively, but there are some good sides to some of the adaptations we've had to make this year as well. So I'm going to come firstly to you, Bola. Obviously, working in the NHS and an NHS trust, it's been a very, very difficult time over the last 2 years having to respond to the pandemic, supporting people who are facing difficulty in their lives, difficult health positions, but also supporting your staff as well. So you know, give us a sense of how you've seen your own workplace culture sort of change and adapt over the last year, and any challenges that you've had to overcome.
Thank you, Sarah. Yeah, just even reflecting on when I started my job, this current job in January the 5th, I started thinking I was going to have a 2 to 3 weeks induction, but on that very first day, we needed to redeploy about 150 doctors and different professionals to other ITUs to support them. And so that was quite challenging for us as an eye hospital. We weren't used to seeing lots of people dying because, of course, what we do is eye care. But the other parts of the system were struggling. And so we needed to support, and, you know, through mutual aid, we had to send people to other places. So it meant really coming to terms very quickly with what does that mean for our staff who are not used to seeing people dying en masse, and trying to support them, but also making sure they can support other people. So that we had to rally support very quickly. Another thing for us in the NHS was around agile working. Not until the pandemic, most of our services were delivered face-to-face, in person. So all of a sudden we had to move people to agile working, virtual clinics, just things we weren't used to doing. And it meant a lot of agility, a lot of resilience, being quite spontaneous and not waiting for hours or days to make decisions, just being able to make decisions on the spot was some of the things we had to look at. And so managing things in with a quick turnaround was one of the positive things for us, because we've now learned that we don't have to take ages to make decisions or meetings after meetings. We're now being able to respond using some of the learning from COVID. We also had to look at things around that were coming out from the government reports around people who were disproportionately affected by COVID itself. In my trust, for example, 53% of our workforce come from a BAME background. And they were the groups that were mostly at risk from the report and the findings through the COVID pandemic lockdown. And so we had to look at risk assessments, making sure that we prioritize the health and well-being of those members of staff, but also being able to listen to their concerns and make adjustments as required. It also meant we were able to think, maybe think more creatively around how we used resourcing. So not just being so, one way minded about how we used people's skills, making sure we could redeploy people to do different things. And of course, we also had to think about, what does this mean for not just the people on the front line, but our leaders making important decisions, because they also needed to be supported. So we had to have a 360-degree mindset about how we were not just supporting the populace, which we were doing, but how we supported our own staff as well as each other, and making sure that each person took responsibility for their own mental health and well-being. And whilst most of COVID had been about physical health, all of a sudden for us, mental health and well-being came to the #1 agenda really, and still is now. And we're managing to incorporate that into every fabric of our working practices to make sure that managers are checking in, making sure they're having one-to-one well-being conversations whenever they met with their staff. So those are some of the lessons we took, and some of the challenges as well. Managing remote teams, for example, was quite difficult with sometimes technological challenges. So how did we manage that? But we've been just working with our colleagues and working as a system rather than just in silo. With the introduction of the integrated care system, we're working with our CCG partners, we're sharing resources, sharing learnings, and those have been really valuable for us in the NHS.
Thank you, Bola. There's quite a few themes coming through there. And one of the things that I'm hearing quite a lot about, not just in the NHS, but in quite a few other more frontline sectors, if you like, is about vicarious trauma. So this idea that you've got lots and lots of staff who are seeing much more hard-hitting issues, are seeing that trauma, firsthand, are really kind of experiencing some of that trauma alongside someone that they are supporting, and how, as an employer, how as a workplace, we can then support those staff in terms of what they're seeing and hearing. And I think that's where you talked a lot about the pandemic moving from physical health focus to a mental health focus, and that that importance to support each other's mental health, but also to support our own mental health as well. So vicarious trauma, definitely something that's coming through quite loud and clear from lots of workplaces that we work with. You talked a bit about agile working. I think we've heard quite a lot in the media about moving to remote ways of working, but I like what you were describing there about that. What used to probably be a project that might have lasted 6 months to 18 months had to be a decision that needed to be made in sort of 6 to 12 days. So there's some positives around that, actually. We've seen lots of good benefits in organisations around that as well. So great, thank you for sharing those insights. Bobby, I'm going to come to you. Obviously, your experience in BP, but also, working as part of the Trans in the City organisation that you have founded and lead on as well. What's 2021 been like for you? How have things changed for you?
It's been, I think, like everybody, a time of rapid change. Taking my day job rather than my gay job of Trans in the City. BP, I think, was very much geared up to remote working, although most people were office-based. As a big global company, we were very used to dealing with people in any of the 70 other countries that we work with on a regular basis. So I guess the technological jump for BP to have people working from home permanently rather than 1 day a week or 2 days a week wasn't so huge. What I think was huge for our employees was actually that distance that extended for a very long time from March 2020 and even to now, where people, especially those people that lived alone, had a large part of their social circle removed, and still do. The chats when you come into work in the morning and you sit down next to somebody, even if you're hot desking, the bumping into people at the coffee machine or going to lunch with people was removed overnight. And certainly, it was my experience and lots of other people's experience that live alone, that actually it turned into something that was very, very isolating. Even talking to people on video didn't have the same impact and same regenerative qualities that, laughing and joking to people when you bump into them in the office has. And I think compounding that is the over the lockdowns, those people that lived alone were having no contact over weekends, so it almost created this really big void that I think lots of our employees struggled with. On the other hand, lots of other employees struggled with trying to balance family life You know, we had lots of employees that were flung into a household that had 2 people that were trying to work from home, and a family, and pets jumping on keyboards in the at the middle, trying to do school lessons from home, trying to do all of that huge juggling, which was massively stressful. I think one of the things that BP did very well actually was, and funnily enough, was actually implementing that culture before the lockdown happened as well, was that model of empathic management, recognizing that employees are people. They're not a number, they're not a staff number that you know is just there to churn out 8 hours of work and then go home and but you know, there are people with lives, and those lives bring outside pressures. And I think really those early days of lockdown, and you know, last year and this year, have really highlighted how that empathic management is so valuable and gets so much more out of people. You know, I think by the time we'd reached the end of the first lockdown, we'd seen you know, senior managers cat's bums in front of the video screens when they're trying to do a presentation. We'd seen people's kids running in and sitting on their laps and everything. And I think actually that's one of the great benefits that this whole period has brought to us actually, is it's kind of smashed that corporate self that people used to bring to work and leave the stuff that was at home that was a challenge for them, because it's all been mashed together and we've all seen it. And I think really that empathy has really helped people. From my day job, CEO of Trans in the City, it's, I think, been largely very positive. It's, you know, I spent a lot of my time running from site to site before, talking to people, trying to help different companies. Moving to that online model has been both much more time economic for me, but has allowed me to expand hugely. I mean, I talk to people all over the world now. I think the only continent I haven't spoken to is Antarctica. So if there is anybody from the British Antarctic Survey on, then I'd love to do a session for them as well. But so it has been hugely beneficial and opened up different avenues of people to join things actually anonymously, rather than going to meeting rooms and listen to different things. So I think it's been hugely beneficial in those sort of things. I think sort of tips and tricks, I guess, of you know, I think when we first moved online, ended up with back-to-back meetings through the day that we wouldn't normally have because we'd be walking. So little tips and tricks like changing your default meeting setting from 1 hour to 50 minutes or 55 minutes is just to give yourself that break, really helps. But lots of challenges, but there have been some definite positives too.
Thank you, Bobby. That's really insightful. You talked a bit about isolation there. You know, again, another huge theme of discussion for 2021, and that sort of void in people's personal lives that's been created from not having as much social contact has been a huge challenge, I think, over the last 2 years, basically. You talked a bit about getting a window into, you know, our whole selves. You know, you talked a bit about that corporate profile of an individual, and you know, the old school approach of treating everybody exactly the same in a very corporate relationship has significantly shifted, hasn't it? You know, we know much more about people's home lives, their setup, what's important to them, everyone's experience of the pandemic, and the different adaptations that have needed to have been made have been completely individual. And I do think you described it as empathic management. I do think that by default we've had to move more into that space, whether we've naturally wanted to or whether that's not our natural style or our natural preference. Those conversations have moved into that space, and I do feel that's one of the positives that has really come out of having to adapt to the pandemic. So yeah, very, very valuable for people, but as you say, lots and lots of challenges. Kevin, moving across to you, obviously at Pearson, how's it been at Pearson? What's changed? What challenges have you faced?
Well, what a year. Profound changes for all our learners. Our children in schools have been closed, and children have had to cope with learning online. Parents as well had to juggle that, our learners generally, but for the workplace, a fascinating change in the culture of the organisation. And picking up on the comments that Bola and Bobby were making, the march of technology. I'm fascinated by technology. I think the opportunities for technology are limitless. And this webinar today is due to the wonders of technology. And we've been able to work virtually due to the benefit of technology. And where is technology going to go in the future? As I say, the opportunities are limitless. However, I still think there's a need for us to have human interaction. And we'll talk a bit about the importance of mental health first aiders in the general well-being strategy and approach. So the workplace culture, largely remote now, virtual. And we were starting to see some movement back into offices. But that's probably going to change again with the announcement that we've had from the government about a plan B. So I think we can say pretty safely that a flexible approach to working is here to stay. I think that's a hugely beneficial thing. I think for many people, remote working is transformative. And I think particularly if we look at diversity, equity and inclusion, we're never going to get to true female equality if we don't nail the work-life balance. In a binary situation, men need to do more around the home. Women are still the project managers of the home and the primary carers. We're evidently not going to change all that overnight, because some of these things are so buried deep into society. However, we're starting to see changes in the approach towards domestic duties and caring in the home, and we're also allowing those that are primary carers and the project managers of the home a better balance in their lives because of remote working, because of the not having to do a commute and not having to be in offices for long hours and not having to deal with a culture of presenteeism. I think what might be interesting to see in the future is if we start to see a return to offices, to what extent are promotions and other opportunities going to be more readily available to those who do come into the office and are present, and if leaders still come into offices, etc. Because maybe leaders don't have the lived experience of most employees, and they have to balance other responsibilities, etc. I think one of the things that we did think was going to come from virtual working was there was a fear I picked up, particularly from leaders in organizations generally, that employees would not be that productive. And I think that's a little bit of a throwback by some leaders back to F.W. Taylor and scientific management. We don't really trust people, they're in it for money, watch them, make sure they work hard. That has not been the case. And employees I've seen in our organization and in other organizations have been incredibly dedicated and have worked really hard. And if anything, the concern is more about burnout. The concern is about too much screen time, not getting breaks. And some of the things that Bobby talked about some of the tips that are possible for technology, adjusting your default meeting times, building in catch-up message time, building in focus time and learning time, some of the tips that are available through technology. But we're all going to get better at the remote working, the virtual working. I think there are a few challenges that come out. I've touched on some of those, and we'll cover that in the next question sort of thing. But profound changes in workplace culture and in society, which are here to stay.
Thank you, Kevin. Again, lots of fantastic insight in there. I remember having lots of conversations with people about that sort of digital fast forwarding of our understanding of how to just use digital platforms, let alone want to be able to use them and use them for good. We're in a completely different situation now, aren't we? I guess around our understanding of digital and what's possible, and what's possible to do in a hybrid world as well. You touched a little bit about that potential risk of creating a sort of dual culture. So I in a way I like to think about it as a triple culture, because we talk a lot about offices and the adaptation and move to remote working, but obviously there are lots of organisations that are not office based and have to be either frontline, might be in manufacturing, engineering, who it's just not an option for them to work from home. So I guess if you've got a whole organisational system, you've potentially got that triple culture going on there if you're working in a truly hybrid way for some of the organisation, where some of the organisation it's not possible to have that opportunity available to them as well. So lots of challenges, I think, particularly when we come to thinking later about what that might mean for 2022 as well, in terms of how do you anchor a culture that also considers the different positions that people in an organisation and the roles that they do, what it might mean for them. And I love the idea of this home working productivity myth. A few years ago, people were really against it. I've personally experienced people who just believed it would be problematic and not good for business. And haven't we proved them wrong, I guess, with that? So yeah, huge myth that anything and everything is possible in a remote working environment, and the benefits of that, particularly from an equity and inclusion perspective as well. In terms of, you mentioned burnout, Kevin, and I suppose, one of the downsides of being super productive and not having the commutes and being able to do your personal life and home life, if you're in a luxurious position of being able to work from home, one of the downsides of that potentially is not the ability to perhaps not be able to switch off, but also, the natural inclination to want to work together and, help your organisation to adapt to what's going on, and therefore potentially overwork, and also take on quite a lot of pressure. I'm quite interested as a panel, what have you learned about burnout, and are there any kind of tips of things that have worked quite well in your organisation that some of our webinar attendees today can kind of take away, because that is definitely going to be a thing to think about going into 2022. So Kevin, I'm going to start with you again and work backwards, if that's okay, on burnout.
Yeah, I think a different approach to working and focusing on outcomes and not worrying too much about traditional constructs of the day. I personally am not too worried if an employee decides to send an email at 10 p.m. That works for them, but they don't necessarily need to send that email at a different time of the day, because that might not suit them in that particular construct of the day. So I think we need to look at the flexibility of work in its whole view, and not be too concerned about traditional forms, but focus on outcomes. I've never seen such an attention to mental well-being than we've seen from the acceleration of focus on that area, because of some of the insights that Bola and Bobby were talking about, we were talking about earlier. We have a glimpse into the lives of people. We have a glimpse into the lived experience of people. I think one of the fascinating things about our virtual world now is we get an insight into people's homes. We sort of see the environment they're making their calls from. Bobby raised a fascinating point about the authentic lived life. So our organizations, are we adopting a more empathetic style, or are we seeing something that organizations don't understand and they're going to have to construct their response? One way that we've done it at Pearson is to have a better brand around our well-being. So we identify the areas of our mental well-being and strategy, and we placed a major focus on mental health first aiders with a global program across the 70 countries that we work in. And we work closely with Mental Health First Aid England. And that we also have many constructs around that mental health first aid program. It dovetails very well with the content and resources and the other programs that we might provide. I think there's a danger in society that we say, okay, sorry, you're encountering a few problems. Here's some links and some resources that you can get on with. Actually, the mental health first aiders provide an important dovetail with content and resources, because here is somebody who is trained that you can talk to, and it's a safe space and it's confidential. And if help is needed, that person can help, signpost to help, and then check in. And I think that's incredibly important. So I can't overstate the importance of a mental health first aid program and the exciting things that we're seeing from the evidence that we're getting from that program.
Thank you, Kevin. So big emphasis on peer support there, I guess, with a formal and supported structure in place behind it. Bobby, from a BP perspective, anything around burnout that you've seen within BP happening that's had a positive impact, really?
Yeah, I mean, I'm probably one of the worst people to speak to about burnout, because having two full-time jobs. But I think really to echo Kevin's points there, it's so important, I think, and actually really going back and again reflecting on that empathic management model, to understand that when people are working from home, we need to try and move away from this rigid 9 to 5 clock in, clock out that we used to do with an hour for lunch, and really let people do the times and the work and manage their workload when it fits around them. And obviously there will be some constraints, because there are times when we need people to talk to other people, but it's having that flexibility is so important. And I think, again, echoing Kevin's point, it's BP are very strong on mental health. We have a CEO who's very passionate about positive mental well-being, and so there's the healthcare offerings that we have around mental well-being support are very good. We have free access to Headspace. We have an employee accessibility program around mental health, as well as having mental health first aiders that you can go and talk to. But exactly as Kevin says, it's those things that are the crutches and the supports and the plasters that help. But what really helps the whole problem is having a holistic approach. There's no point having places, apps that people can download and use if the management structure and ethos of your organization is one that you can't take the time out to use them, that you can't have a space in your day just to decompress and say, what, I'm feeling really stressed today, I'm not going to spend as much time working on the things that are really going to stress me. I'm just going to take a tiny bit of a step back and breathe and work on less stressful things, because those things recharge people to be able to face the things that are stressful, and you'll get far better performance from people, and have, frankly, people that will stay with your organization that are really valuable if you just let them have the time to be themselves, to have that space just to take a breath and not have that great wave that we all face, from time to time, that just feels like it's just going to swamp us. So it's that real, get it embedded in your organization that it's okay to have mental well-being challenges, and it's okay to take time out to deal with them.
Thank you, Bobby. And Bola, finally, just thinking about burnout, I guess from a frontline worker perspective, it's a very different type of burnout. It's not as easy to kind of take time out perhaps in the day. What would you say has worked quite well in your organisation around that?
Yeah, you're right, Sarah. For us in the NHS, I don't think a number of our frontline staff could not necessarily say, I'm too tired, I can't attend to that patient, they're waiting there. So what we've done is to up our psychological well-being support to staff. So at the beginning of the pandemic, or at the beginning of this year, actually, we introduced chaplaincy and pastoral support for some of our staff members, and they would, the chaplain would walk about and talk to people, knowing that they needed sometimes to decompress and just talk to somebody, especially if they've had really difficult patients. We also opt our psychological support on a one-to-one basis. So we have some psychologists just going around talking to people without wanting to micromanage staff. We started to look at the utilization of annual leave, because with NHS workers, they're working shift patterns and they're not necessarily able to come out of it unless they're sick. So we've started to make sure that we monitor that to prompt managers to encourage their staff to take annual leave. So if they also equipping managers to manage their staff, because we recognize that they have the biggest impact on their own staff's health and well-being. So we started to develop programs, learning circles for the managers themselves, so that they can become aware of their own, what's going on for them, their own emotions, so that they can support their staff, and therefore being able to recognize if somebody is a little bit off or they need some support. But we found that annual leave monitoring is helping, because it means managers can say, you've not had time off for the last, however long, you need to book time off, or I'm encouraging you, without wanting to take control of people's lives. But it's just one way for people to get away and decompress and rest. But also, leading by example as well. Some of our leads started to take annual leave themselves, say, I'm going to take that time off, with the aim that when our colleagues and staff see that, they too will prioritize that they need time off. So those are some of the things we've been doing, increasing the support on the front line, but also doing practical things to make sure people take time off and just decompress. And when necessary, gauging where there is need for additional resources, because with clinical work, you can't always, as I say, you need to look at, do we need more people? If people are off sick, giving them time to recover is another thing, and making sure that there's additional support. And finally, thinking of what we need to pause, stop, or continue for maybe non-clinical workers, in terms of, if we need to do this, what else needs to go, so that people don't feel that they just have to keep going on, really.
Brilliant, thank you, Bola. We're keen to hear from you who are attending live on the webinar today, in terms of how 2021 has been for you. So we've got 2 polls for you today. So you'll shortly see our first question appear on screen. You'll have about 20 seconds to respond to that. The poll is anonymous, so we're not able to see how you've answered, but it's just good for us to take a bit of a temperature check, really. So our first question is, how has your mental health changed since the start of the pandemic? Has it improved, has it worsened, or has it stayed broadly the same? Just give you a few seconds to answer that. Okay. And let's have a look at the results there. So 25% of you have said that your mental health has actually improved since the start of the pandemic. 50% of you have said that it's worsened, and around about 25% of you have said it's broadly stayed the same. Kevin, does that resonate? Is that probably representative of your organisation?
I think that's probably representative. I think, though in a way you could say that it helps us in that there's always been a stigma about mental health and mental well-being, and people have mental health challenges. The world and society can be tough, and we know it's not a fair world, and there's progress that we need to make on in a number of areas, and so if this means that organizations and society have a better understanding and focus on mental well-being, that employees, as Bobby was saying, getting away from this corporate self and this sort of corporate identity, and some of the stuff that Bola was saying about changes in the workplace are incredibly important. So yeah, I mean, I think that's pretty. I'm not surprised by those results, and I'm not surprised. It's for some people it's improved, because, as I say, remote working for some has been transformational. They haven't, their well-being is much better, and they haven't got those awful commutes to worry about and those long hours and presenteeism. However, for other people, it's been very challenging, and it's also increased isolation and feelings of loneliness. And there's a couple of good questions in the chat that we'll come on to about, what have organisations done to combat that. So,
okay, thank you. We're going to move on to our second poll question now. So again, you'll see a question appear. You have a few seconds to answer that. The second poll question is: has your workplace provided more support for your mental health and well-being in the last 12 months? So have they provided more support? Have they provided the same support as prior to the pandemic? Or have they provided no support, actually? So a few seconds there for you to answer. Okay, and we'll have a look at the results now. Okay, so 68% of you are saying that your organisations are providing more support, which is fantastic. 28% are saying it's the same amount of support that you had prior to the pandemic, and 5% sadly are saying that their workplaces provided no support for them around their mental health and well-being. Bobby, how do you feel about those results?
I think that's kind of reflective of my experience talking to lots of organisations. I mean, I guess the looking at those results, the provided the same support as previously infers that support was adequate to begin with. Although I think if we look back pre-pandemic, I think we can safely say that most organisations didn't have anywhere near the amount of focus that was needed on mental well-being. So actually, I think if we look at those levels, I think what we can see is actually that the same support and provided no support are actually probably more negative than the poll results actually say. And of course, providing more support doesn't mean that they're providing sufficient support either. I think even those organisations that are doing mental health and mental well-being support to a greater degree and are doing what we'd consider a good job, I think would be the first people to say, there's a hell of a lot more that we need to do, because it's one of those things that the more you become aware, then actually your boundaries shift onto what you actually understand that you need to do. I think we normally start off with a very small viewpoint of like, oh, we need to deal with a bit of stress and stuff like that. But actually, when we start exploring on what we need to give our employees, the horizon and the amount of support that we need to give people and the amount of freedom that we need to give people to tell us what the issues that they're experiencing are expand hugely.
Definitely one for everyone to think about as we go into the new year, especially with yesterday's announcement of further measures and further restrictions and possibly some more to come in the future, I guess. Okay, before the webinar today, I spoke to a few people in Mental Health First Aid England. We obviously work with lots and lots of workplaces, and just a quick kind of snapshot of some of the things that we've seen that have been kind of good learning from the organisations that we work with. I think we've touched on all of these in various ways over the last half an hour. But workplaces have become much better at consulting with staff, and we talked a bit about this personalised experience of the pandemic and this empathetic approach now to management being essential, really, to understand what's happening for an individual and what specifically they need for personal levels of support. But organisations seem to be consulting more and asking people what they need more, which is great. We've seen lots of organisations ask their staff about, should we move to fully home working? Should we be a hybrid organisation? What hours would you like to work in a space? What hours would you not like to work? So, lots of kind of big C consultation, I guess, around the future of ways of working as well. And we've seen lots of people continually reviewing. We've all been learning and trying to adapt as we've gone, and we've had to kind of test and learn. So this idea of implementing something and then going, is that working? Do we need to tweak it? Do we need to do something differently? Seems to be something that lots of organisations have got really right this year as well. Spotting the signs of mental ill health or poor mental well-being, I think, people are starting to get a lot more in tune with this and are asking the question more. But obviously one of the big challenges is it's been a bit more difficult where people have been able to remotely work to kind of pick up all of the time. So we've seen lots of people grapple with that as a challenge, but we have seen lots of organisations really asking the question more, every one-to-one, starting with how's your well-being, how's your workload, is there anything that you need at the moment that's going to help you in your role and help you personally, which has been fantastic. We've seen lots of organisations use different tools to help check in on wellbeing. One of the tools that we promote here at Mental Health First Aid England is the My Whole Self MOT. So there's a free toolkit you can download on our website that you can sit down with a colleague, someone who reports into you, and just check in, how are they doing, and walk through some different aspects of their life and different aspects of work, and work out what you might need to do or what they might need to do to support themselves as well. I definitely advocate for applying that to yourself every once in a while. We always talk about not being able to pour from an empty cup when we talk to organisations here at MHFA England, so applying it to yourself is definitely important too. We've touched a little bit about not just people's individual experience of the pandemic, but also being able to bring their whole self to work. So we talked about, Bobby, you put it in a lovely, eloquent way of people, cat's bums, I think was a phrase that you used. But on the serious side of things, we've also got a window into people's personal lives that we wouldn't have known about before, people's identities as well. We've had conversations with people who are caring for elderly relatives, and that conversation has become much more at the forefront of what they need and the time and the flexibility they need to support their elderly relative as well as do their job and work from home. We've seen people who have talked more openly about their experiences of racism and discrimination in the backdrop of lots of things that have happened in the world as well. And we've broadened that conversation out to lots of different aspects of people's identity, their lifestyles, just the way that they live, their personal lives. And I think we've seen real benefits of that. People have felt supported, have felt valued, and have been able to be much more productive and deliver more as a result of being able to feel open as well. So, lots of organisations are getting that right as well. We've spoken to over the last year. And again, lots of people who I think it was probably the end of 2020, early 2021, where we all thought we might be getting back into the office a bit more. We all started talking about hybrid strategies. So lots of organisations said we're going to have a brand new mental health and wellbeing strategy. And here we are a year later, still having to adapt and make changes. So lots of people are continually, it's no longer a 12-month plan or a 3-year strategy. It's an agile, flexible, ongoing, adaptive process to get that mental health and wellbeing approach right. And I think it's difficult for people to sort of sell into their organisation, here's what we're going to do for the next 3 years. It's much more about what can we do over the next 3 months based on the context and backdrop of what's happening at the moment as well. So I'm going to move on now quickly with the panel before we go into the Q&A. Can you kind of briefly share, everybody on the webinar here today is thinking about going into 2022 and what they might need to think about for mental health and wellbeing. We've also had Boris do his press statement yesterday, giving us some new interesting things to think about just to make it more challenging. What one thing could somebody on this webinar do in their workplace to support mental health as we go into 2022? Bola, I'm going to start with you.
Yeah, I'd say we need to recognize that not one size will fit everyone. And so being adaptable and also the commitment to flexibility and agility is going to be paramount because the landscape just keeps changing. And maybe thinking about upskilling our managers with lots of emotional intelligence and cultural intelligence, and not just about race, but culture, because everyone has their own different culture. So, you know, we need to be aware of what does that mean for Kevin, what does that mean for Bobby. So being able to do that and just being open-minded and knowing that the road to recovery is long, and that support empathic management, I think that would be really key.
Thank you, Bola. Bobby?
I think it's you know, I think Bola summed it up fantastically well there. I think it is that, you know, just be kind to each other, actually, mainly, and collaborate. I think it's so important that, you know, we collaborate within our organizations and we collaborate outside of our organizations, and we start doing, you know, I mean, that's a central thing that we do for trans awareness in Trans in the City, but I think it's so important for people to start talking to other organizations and find out what works, find out those tips that are really good, and help those other organizations that have issues implementing some of these good practices, you know, whether, and that's not just, you know, we're not talking just on corporate levels there, we're talking about those organizations that have issues around social mobility and internet poverty and all of those things. You know, start helping those organizations, because, you know, we are in a real dangerous situation of haves and have nots, actually, when we start talking about the this new you know, online world where, you know, we're in a very dangerous place of those people that are privileged are going to go screaming ahead with a load of advantage over those people that were already disadvantaged in the first place. So really important to collaborate and remember that it's about sharing as well.
Thank you, Bobby. And Kevin?
Well, I think Bola and Bobby put it beautifully, really, and summed it all up. I would say that to back up their points, I would say that workplaces need to focus on the lived experience and the human condition. If you can understand the lived experience of your employees and their human condition, then you're better able to support them, and they're better able, therefore, to achieve their full talent, which is what organizations are seeking to achieve ultimately. So a big focus, I think there's going to be a big focus on the lived experience next year in organizations in society, and picking up on the points that we've been making on the panel. But so I've watched that space, actually, but that's what I think is the big thing.
Kevin? We're going to move across to the Q&A now. There's some great questions in there, some very specific questions, I think, for individual panel members, and some broader questions that I'll open up in the last few minutes. We've talked a lot about workplaces and employees, I guess, but, you know, there's a huge amount of people who are self-employed who don't work for a workplace. So, Bobby, one for you, really. You know, what tips have you got for individuals who might be running their own business, might be self-employed, around their own mental health and wellbeing as they move into 2022?
It's a huge challenge, and, you know, I mean, there's been, you know, actually I've only been permanent for a little bit over 18 months now. I've been running my own consultancy for 10 years before that, and it's always a huge challenge when you're self-employed, because you have those challenges of knowing that, you know, if you take a holiday, you're going to lose some pay, or that's how it feels. And, you know, there's all of these larger pressures around different tax models and stuff that came in at the same time that the pandemic hit, and all the rest of the stuff. So that there are massive pressures on self-employed people. Just look after yourself, you know. It's the bottom line is, and like I say, you know what, I'm probably the worst person to ask for advice with this. You know, I regularly work 14 and 16-hour days, 7 days a week, sometimes through the year, you know, especially in some of the more busiest times for trans people. But, you know, just appreciate that actually the more you work, the closer you get to burnout, the less effective you'll be working, the worse decisions that you'll be making. So sometimes stepping back and giving yourself a break will result in better productivity. But you know, and I completely appreciate how hard that is when you're running your own business, especially when you're trying to get it off the ground.
Thank you, Bobby. I've spoken to a number of sort of self-employed people during the pandemic, and I think the thing that they've most valued is where they've joined a kind of network, or they've connected in with like-minded people. So if you're not brilliant at applying self-care to yourself, you know, you're probably brilliant at connectivity and creating relationships, because you know that's what will make you successful in your role as an independent self-employed person. So utilize that, join some networks, join some groups, set one up if there isn't one available, and I imagine there'll be lots of people chomping at the bit to join that as well. Another question in the Q&A is, we've talked a bit about hybrid working, but lots of organisations are thinking about, do they fully go remote? So there's a question about what the panel might think about retaining the option to work on site in the office, and that research might suggest that levels of isolation, anxiety, domestic abuse, etc., are intensified with remote home working. Bola, anything from you on what's your view about, should organisations be looking to retain some form of location-based working rather than just home?
Absolutely, I think so, because we're relational beings, and part of the reasons people come to work is the community. They feel a sense of belonging, and for us in the NHS, one of our priorities for an NHS people plan is that staff feel that they have a belonging in the workforce. So for us, it would be crucial to still have a base, of course, using it as a means of improving flexibility, also a place where people can come back to connect, and knowing that not one size will fit everyone's circumstances. Some people don't have a garden or a separate room to work, and it's recognizing that and being more inclusive, because inclusivity is very wide ranging, and making sure that there's room for everyone somewhere, somehow. Definitely agree with that.
Thank you, Bola. And then one final question, really, which I'm interested from all of you on, is with the announcements yesterday of further measures and some uncertainty of what might happen beyond that, is there anything that you would share with what should organisations, what should workplaces be doing right now to think about how their staff might be feeling, or what they might need over the next, who knows, 4 weeks, 8 weeks and beyond, I guess. Kevin, let's start with you.
Well, flexibility. Understand, all employees understand that we have a flexible approach, so they can, and also that access to the office is still possible for the points that Bola made, but in critical circumstances and with protocols, etc., for safety and well-being, and also making everyone aware of the existence of all our trained mental health first aiders that are available, and the content and resources that we've got available to us.
Thank you, Kevin. Bola?
I think definitely it's going to have a massive impact on just thinking about the changing landscape, the pace at which things are changing. We've just around April brought some of our corporate workers back to work in a hybrid fashion, and now that means we have to risk assess from today onwards to start looking at, do they all need to be here? So being able to respond very quickly to those kind of quick changes is something that we're constantly adapting to. And as Kevin said, being flexible and thinking about, what does this mean for us in the NHS, because a number of our services are still delivered face-to-face. It would mean that some people cannot work remotely or in a hybrid way, and we have to manage how they feel. They've been here since before the pandemic, throughout the pandemic, and even now. How do we manage their perceptions and how they feel compared to those who have the opportunities to work from home? So managing people's emotions, perceptions, and just providing support that we're all in this together would be really key, because some will be feeling quite dumb by the whole process. So managing that as well is quite key going forward.
Thank you, Paula. And Bobby, if there's anything you could add in 10 seconds, given our time restriction, what would that be?
It would just be recognise that the anxiety over the uncertainty of what's happening is something that we really need to recognise for employers. I just want to actually probably go with my 10 seconds, but I just want to thank Bola for everything that she does and everything that the NHS has done for everybody over the last 2 years. I can't imagine how hard it's been. You're amazing.
Definitely echoed that, Paula.
Thank you, Bobby and Sarah.
Thank you very much to our expert panel. There are some useful resources and guides on the final slide, which you'll get a copy of, that you may want to go and have a look and get some more ideas and information about. Thank you to our amazing panelists for sharing their insights and their wisdom about what's been a roller coaster year. Inevitably, next year could also be a bit of a roller coaster, but hopefully our panel have given you some ideas, some hints, some tips of things to think about as you go into the new year that might help plan for better wellbeing in our workplace cultures in 2022. Thank you to everyone who's attended the session live. We hope you've taken away lots of thinking and practical ideas. We'll be uploading the video onto YouTube later today. I wish you all a relaxing break over the Christmas period. Do look after yourselves. Self-care is definitely one for everybody to think about during the break. And we will see you in the new year, where we're going to publish a new programme of webinar activity. So look out on our website and on our social media channels for the webinars, the dates and the topics for next year as well. Thank you very much. I hope you enjoy the rest of your days.